At AYSO, player development starts in the small moments, the reps and drills of practice, but lessons and planning, with positive coaching and encouragement. And during game days, that development comes to life. It's where it all comes together. This is where kids learn grit, resilience, teamwork, and confidence. This is where kids have fun, develop skills, and fall in love with the game. This is where memories are made, where families connect, where lifelong friendships begin. It's where we practice good sportsmanship, and where everyone plays. AYSO creates the stage where young athletes discover what they're capable of, where tough challenges turn into proud moments. This is soccer with heart. This is community. And it's all made possible by volunteers who bring the best game in the world to our families every weekend. This is AYSO.
As we continue our commitment to ACL prevention and awareness, we're delighted today to be joined by Dr. Carlos Uquillas, pediatric sports medicine surgeon at Cedars Sinai Hospital, and equally as important, an AYSO U10 coach to both boys and girls. So thank you so much for taking time out of your busy day to spend with us today. So, committed AYSO volunteer, 10U coach, how did you get involved in coaching? Was it through your own children, or were you always involved with soccer?
I played soccer my whole life. It's something that I always enjoyed, and I still enjoy now, and I think it's something that I wanted to have my kids hopefully learn the joy of soccer. So as a coach, I think I'm evolving kind of week by week, and I'm learning how to keep it fun, be more supportive, and make it a positive experience as opposed to just focused on competition and winning.
How important are sports to youth today?
I think it's very important. Right now, kids don't have a lot of free play. Everything's structured. So sports is one of those things that allows some freedom in movement, freedom in play, and really our competition for kids is screen time. So we're competing with something that provides almost immediate dopamine rush. And I think sports is one of those things that can actually compete with that amount of screen time. It builds teamwork, it builds communication, it builds social skills. It's getting them healthier, it's building endurance, speed, just overall becoming healthier, happier kids.
So you're talking really much more of a holistic benefit than just the physical participation part, right? And in today's environments, do you see a trend going towards early specialization, in which case, how does that impact holistic benefit for child and parent?
Well, you're absolutely right. I think sports does provide a holistic benefit, and especially when we're talking about the masses, kids in general, we need to focus on that holistic benefit. Certainly there's going to be some kids that want to play further into college and pros and have the skills to do it, but that's very few kids that result in that path. So we really need to focus on benefits that can apply to everyone, and that's where the emotional, social, psychological benefits come in. A lot of times, especially parents, and I'm one of them, we start focusing on competition and accomplishments and thinking about will they earn the scholarship or not.
Yeah.
And I think that's where we're getting into trouble by really focusing on acquisition of skills as opposed to acquisition of athleticism and fitness.
Are you seeing now a difference between how we approach that performance pathway athlete versus participation in social play? Are you seeing a difference in that?
Yeah, I do see that there's a difference when you start specializing at an early age, focusing on skill development and competition as opposed to free play and all the other benefits that you get from sports. I think there are some benefits. Kids who play around are probably more skilled than the ones that don't. But there's also some risks. There's increased risk of overuse injuries, increased risks of burnout, increased risks of quitting the sport. So although there are some benefits to prioritizing one sport over the other, there's also a lot of benefits into diversity in sports and diversity in movement. And I think that's one of the things that we're trying to focus on, is how to identify what will decrease those risks in terms of injuries and overuse injuries for kids.
In terms of injuries themselves, we've obviously done a lot of work in the ACL space, and that's the reason that we have the partnership today. In general, are ACL injuries on the rise in all levels of sport? Or is it more towards the performance pathway or the participation in social?
It's both.
It's
really
both.
is
So
both.
it's generic. It's across the board.
Yes. So we're seeing higher incidence of ACL injuries kind of throughout the population. Part of that is because there's more awareness of it, but also there's a lot more athletic exposures. And with any sort of disease process or injury, the number of athletic exposures really has a direct impact on injury rates as well. So if you play more soccer, you're probably more likely to get injured. So that's where the injury prevention part really plays a big role in trying to decrease that risk of, not of athletic exposures, but risk of injury during those athletic exposures.
So obviously the research project and the results of that is the accumulation of a relationship we've had now for 3 years. The first year we had generic awareness workshops related to first aid, and obviously the ACL topic got a high attendance rate and interest, and that kind of stimulated a focus for the second year, which was about ACLs. And then we came to the third year and we've had the research project. Can you tell us a little bit more about what went into that and also the outcome?
Sure. So our big question was, why are these injury prevention programs not being implemented? We know they work.
Yep.
We know that they can require time and effort, but why are they not being implemented? Because in our minds as physicians and clinicians, we think if something works and it's going to prevent injury, why aren't we doing it?
We should do it, yes.
But there's also reality to it.
Yeah.
And we wanted to investigate what are the hurdles to implementation? What's getting in the way? So we wanted to enroll 20-some teams and see if we can implement these injury prevention programs and see if we can find some of the hurdles that we're facing and why they're not being implemented more widely. What we found was that we did have a low response rate from coaches. I think that it does require a lot of time and effort, and if there's something new, sometimes it changes their habits.
So the mentality to commit that time to a prevention program was a hurdle in itself.
Correct. There was low motivation from the athletes too, so I think we need to spend more time educating them and telling them why it's important. But also that it may not be worth calling it an injury prevention program, but more incorporating into things that they're already used to doing, like a warm-up. So I think what we found was smaller, more digestible additions kind of as they get older is going to be much more tolerated and much more successful in the long term than throwing big programs at them from the start.
For both athlete and coach.
Correct, yeah.
Who has the mentality that it's taking time away.
Yes.
So a more manageable, digestible program. And hopefully we get a better buy-in from that. And,
right.
Yeah. The fact that we will write it into the curriculum for training, do you feel that's going to help? Or do you think that the fact that we've got it in more bite-sized packets, that's going to be the key, or a bit of both?
I think it's going to be both. One of the things we found on our study was one program, which was slightly shorter, was more widely implemented than the other one. So I think having more digestible, smaller segments included and increased by age is going to help with implementation in the long term. And you'll probably see more of those benefits in the later years when we're actually seeing those injuries and hopefully a decrease in those injuries. And by incorporating the teaching for coaches early on, I think that's going to help with implementation too, because it's establishing that this is something that we want to emphasize and do.
And the fact that we will eventually have it as part of our certification program, again, can only help coaches take the time to do it, right?
Right. It's all about repetition and emphasizing the importance to it.
And education.
Yeah.
An ongoing commitment to it.
Correct. Yeah.
Okay. If prevention is ultimately key, why have we had a tendency to wait to the later years, and I say later years, 12, 13, from what I've seen in the baseline data, before we start prevention training?
Well, it's tough because we know ACL prevention works. There's several injury programs that have been demonstrated to work at reducing ACL risk. And there's been studies that show the earlier start, the more likely it is to prevent injury. The more you do it, the more likely it is to prevent injury. But we're waiting because it's really tough to implement these at an early stage. It's tough on the coaches, it's tough on the kids. It really takes a good amount of dedication and commitment to do so. And a lot of these habits just aren't built yet. So once you start getting into the early teens, I think you start seeing some of these injuries, so it becomes more in the forefront of people's minds that these are a real problem.
Yeah.
Meanwhile, they don't really happen too often in an 8-year-old. But in a 13-year-old, you're going to start seeing some of your teammates go down with ACL injuries. So parents, coaches, and athletes start thinking about it more. It's also easier to teach a teenager who has better control of their body, who is better able to make the commitment mentally to do these injury prevention programs. So we're more likely to try to implement them at those ages.
Right. What do you say to the classic coach responses, I don't have time for that in addition to my X's and O's and all my tactical genius that I need to impart in my 10-year-olds? What do you say to the coaches? Because that's a common response.
I feel it. I don't have time for it either. It's tough to prioritize that when you're not seeing a direct, immediate result come out of it. I would say it's similar to water breaks. It takes away from your time of training, it takes away from your X's and O's, but it's necessary for kids to stay healthy to have a break and drink some water.
That's a great analogy. We give them plenty of water breaks.
Right.
So why can't we find time for the prevention, right?
And it's tough to keep the kids sometimes interested in
Sure.
it. So one of the things we found in our study that we did is there wasn't a lot of commitment or interest from the kids itself. So I think finding ways to make it interesting is a part that we need to figure out, and building habits. So it all has to do with habits. So starting small and being consistent with it, having the support from coaches and parents is really important. But if we go and give them a 45-minute injury prevention program, that they're not going to get injured or less likely to get injured, but they're also not going to do it.
Yeah.
So it's that implementation that we're finding is the tough part.
So $1 million question, 10U coach, can I expert in the field here? Do you have a ACL prevention program for
I'm
your
trying.
10-year-olds?
I try to do it. The very first practice, it was like I was just overwhelmed with new kids and things like that. But since then, I have been implementing a modified program. So, there are 7, 8, and 9-year-old kids that I'm coaching.
Right.
So we're doing 3 exercises during the warm-up. I'm not calling it injury prevention. It's just a warm-up.
Part of the warm-up.
Yeah.
Part of the routine.
Exactly. So then, they know they have to warm up. They know they have to do some stretches. This is part of it. And I think if we build that into a consistent part of their practice, then as they get older, we'll make it probably a little bit longer. They'll also have more time in practice, usually more practices during the week, but they'll be more likely to continue it. So I'm trying to build those habits.
Do you think that's key? You bring up a really interesting point there of it being integrated in versus in isolation, before we get going or whatever, you blend it into a warm-up. Do you think that's key to ultimately long-term buy-in?
I think it's key for the coaches to remember.
Yeah.
I think it's good for the athletes to expect it, but also you have to make it fun. So one of the things I do is I have them do a plank, and I'm counting the seconds to see who can hold it the longest and trying to get them to 30 seconds and now a minute. So making it fun for them is really important too.
So that's the perfect segue into the AYSO research program that you put on in the spring. And now we have kind of a production of exercises that we can do, that bite-size quantity per age group. Tell me a little bit about how you came up with that specific number for each age group so that we can...
Well, it's a work in progress because what we're finding is that we know these injury prevention programs work, but they can be quite time intensive and resource intensive. And the high-risk groups are the older kids, so once you're a teenager. But if you start at that age, it's going to be much harder to create those habits. So what our vision is to create a more doable set of exercises so we can start earlier to create those habits. So we know that a lot of what injury prevention is core muscle control, proximal muscle control, core muscle strength. So focusing on some of those exercises that focus on that is really important. I have
like the plank.
I have them do a plank.
Yeah.
I have them do some squats, and I have them do some chest passes with one leg raised. So that creates better balance, better core work, and also some lower body strength. And some of these programs prevent injury, but also they improve performance. So I think if we also focus on that, telling parents they're going to get stronger, they're going to get better, hopefully there's buy-in from parents too, because even though we try not to focus on just performance, it is part of it.
Don't you think, considering the idea that prevention works, prevention exercises and programs work, and if we do find that right balance of what the quantity should be and the time allocated, if we do start at the younger ages, as we're doing with the AYSO project, that could have a significant impact once you get to that 13, 14, 15. If the habits are there, the exercises have been implemented, the coaches have become aware of this is part of my routine. I'm a little biased, but it sounds like it could be a little bit of a game changer.
I think so. I mean, I treat ACL injuries for a living. That's my job. That's what I do the most in my practice. I still don't like to see that 13-year-old girl come in injured. It's really an impactful time of their lives. They have pain, they have physical issues, but also they're taken away from their team. Usually that's their social network, that's their friends. That's a way that they get a lot of their energy out, and that it helps them psychologically and emotionally too.
The mental impact of an injury on a child. Yeah.
So I think if we're really working to reduce these, I think it's going to create a huge impact on the kids individually, but also on the nation as a whole.
Yeah.
We have 300,000 ACL injuries a year in the United States. That's a huge amount of ACL injuries. And if we could prevent a fraction of those, I think that's going to help not only those kids, but also the teams, also the communities, and also the overall kind of financial burden on the system. So I think there's a lot of potential advantages to it.
Well, we're very, very excited about it. Do you think overall as a youth sports community, with this type of program or effort, we can impact this trend, this increase in injuries, and hopefully turn it backwards a little bit?
I think so. I mean, it all takes time, effort, and dedication. And I think if everyone's committed to it, including both the AYSO system, but parents, coaches, and players, I think it's something that we can change and make a dramatic change in over time. I
think if we had continued on the pathway of a 30-minute program that we've suggested for every coach and I don't think the buy-in was going to be, I don't think it's a natural integration for that into a 60-minute practice for a grassroots coach and the team, or parents for that factor, regardless of the fact we know it's beneficial. So I think this modular approach and scaffolding it is going to be very, very well received. Is there anything that you think still needs to be done as a community to help with the overall issue? Well,
I think more education is key. You may have a player or two in your team that get injured. You may not for many years. So sometimes you're not even aware of ACL injuries and how common they are. So making people aware in the community that these are real injuries and they happen pretty often is key. And having either players that have had these injuries or families that have had kids with these injuries kind of tell their story, I think is going to be important in the future. So they know that it's not just ACL and they're back in a year, but everything that kind of goes into it too. So it makes it more of a real risk in their mind, and that'll create more buy-in. So education is really important. I think focusing on player development is important, skill development is important, but also continuing to focus on just having them have fun and enjoy being out there is good. So for their overall physical and mental well-being in the future too. And not comparing ourselves to some of these academies that are playing year-round and they're doing great, because they also have a lot more resources than we do, and they focus on so many other things that we can't really focus on a daily basis. So I think we need to kind of keep realistic goals. We need to slowly introduce things to create habits. But I think it's all very achievable. Yeah, and I think we're on the right track. Yeah, I would agree. Thank you so much for your time today, Dr. Uquillas. I've enjoyed talking with you. It's been my pleasure. Thank you. Thank you.